CDC, and I'm delighted to be with you here today to provide updates to everyone on where we stand with respect to COVID-19 and provide some context around many of the changes that have occurred across the COVID landscape recently. Overall, across the state of Maine, there are a total of 74,022 cases of COVID-19. That's an increase of 363 cases just from Saturday alone. Of those, 53,635 are confirmed cases and 20,387 are probable cases. Thus far in the pandemic, Maine has logged 924 deaths among Maine people who have passed away with COVID-19, and cumulatively 2,252 hospitalizations among individuals hospitalized with COVID-19. Right now, in the state of Maine, 117 people are in the hospital being treated for COVID-19. 59 of them are in a critical care unit, and 26 of them are on a ventilator. Let me pause for a moment to put those numbers in perspective. 2 weeks ago, just one incubation period ago with this virus, there were 57 people with COVID-19 in total in Maine hospitals. Today, there are 60 more people in the hospital today than there were just 2 weeks ago. To provide a little bit more context around that, there are more people in the ICU with COVID-19 than were hospitalized in total across the state of Maine just 2 weeks ago. And in that same 2-week period, the number of people on a ventilator in Maine has more than doubled. It continues to be the case that 70 to 75% of the people who are in the hospital with COVID-19 are not fully vaccinated. I can't think of a starker series of numbers to show the impact that COVID-19, and in particular, the Delta virus, the Delta variant, have had on Maine just in a 2-week period. A close companion to the number of people in the hospital is our overall bed capacity. Right now in the state of Maine, we have the capacity for 329 people to be in an intensive care unit. As of yesterday, there were 52 intensive care unit beds available across the state of Maine. Now, it's important to note that those ICU beds are not specifically set aside for COVID patients. Those ICU beds are for everyone out there, anyone out there who might need critical care, perhaps because of a car accident, a heart attack, or major surgery. This is a reminder of the ongoing challenges that COVID-19 poses to our healthcare system, and a reminder that our healthcare colleagues care for more than just COVID. In terms of our overall testing, our positivity rate for PCR tests now stands at 4.3%. But again, 2 weeks ago, just one incubation period ago, it was 2.9%. Our testing volume, however, has gone up. It now stands at 333 PCR tests that are being conducted for every 100,000 people in Maine. 2 weeks ago, that number stood at 258 per 100,000. This represents a 29% increase in the number of PCR tests that are being done in Maine just in that same 2-week incubation period. Vaccinations, too, are continuing at a steady clip. Overall, across the state, we have administered 1,625,117 vaccines for people to protect them against COVID-19. This translates to 947,195 Maine people who have gotten at least one dose of COVID-19 vaccine. This number has been increasing, a good and steady sign. Indeed, compared to that same period 14 days ago, there's been a 33.4 33.4% increase in the daily number of vaccine doses that are administered across the state. That too remains a good sign that we're continuing to make progress. I'd like to take a moment now to talk about some other things that have changed on the landscape. And after that, we'll get to some questions from our colleagues in the media. The first is where we are with respect to genome sampling and genome sequencing for the Delta variant. Now, I've talked before about the work that we do to sequence COVID-19 samples. This is like doing a DNA or really an RNA fingerprint on a positive result. We do this sequencing work in partnership with other labs, most notably the Jackson Labs here in Maine. Most recent results from our work to sequence the viruses in Maine, which we post on our website, the most recent results show that nearly 100% of the samples that are sequenced in Maine are the Delta variant. 100%. Delta is not just the predominant variant in Maine, it is the variant in Maine. This is a concern. Delta is more contagious and may lead to more severe illness, which may lead to higher rates of death. In addition, the ultimate impact and ultimate susceptibility of children to the Delta variant is not yet well known. But as a result of the greater spread of the virus driven by the Delta variant, testing volumes are up significantly, as I noted a moment ago. This has had an impact on Maine CDC. Now, results from COVID testing are reported to the Maine CDC from laboratories across the country electronically every single hour of every single day. We review those electronic results on an ongoing basis to determine which of those results are new versus being a repeat test. And for those new results, we deem those what we call a case and send them out for investigation. Right now, as a result of the significant increase in daily positive results that are reported, there are roughly 1,700 positive test results that are awaiting Maine CDC review. These are results that have come in over the past 36 hours. And as we review those results to determine which of them are new COVID cases versus repeat tests, we'll assign them out and log them as new cases. What this means is that over the next few days, the number of new daily cases in Maine is going to go up, perhaps significantly, as we review those 1,700 results. The bottom line there is that you should expect to see more cases per day over the coming days as compared to the prior few days. The next thing I wanted to note is where we are with respect to outbreaks and where those outbreaks are. Right now, well, first, the definition. An outbreak per Maine CDC and really US CDC guidelines is defined as 3 or more cases that are connected in some epidemiological way, either in time or in space, because they happen to have a close connection with one another. Right now in Maine, there are 21 open COVID-19 outbreak investigations. But what's more important and more concerning is where those investigations, where those outbreaks are. Of those 21 open outbreaks, 9 are in healthcare facilities. These are facilities where the employees would be covered by the vaccination rule that Governor Mill announced last week. This is further evidence of why vaccinating our frontline healthcare workers is more important now than it ever has been before. Not only do we want to protect them because they're putting themselves out on the line every day, we want to protect anyone who goes to those facilities so that those workers can keep true to their oath to do no harm and accidentally infect someone. But we also want to keep the entire cadre, the entire force of healthcare workers strong and healthy. We're in a situation, again, where 9 out of the 21 outbreaks, nearly half, are in those facilities. That means that the residents and those who seek care in those facilities may find it hard. force protection is just as much a part of the rationale as anything else to keep those facilities safe, up, and running. And finally, I want to close by trying to tie all these threads together, by taking a moment to talk about where we are right now and what it means for you in your daily life. Now, for the past year and a half, we have been asked as humans to do something that, frankly, we're not that great at. And that is to assess risk and then make judgments and actions accordingly. In the United States and in Maine, making those decisions during the pandemic has been challenging just at baseline. And more recently, I feel like it's been made harder by the widespread mis- and disinformation that's out there about COVID-19 and the vaccines. But what makes things frustrating for me right now is this persistent sense of an elusive promise that just never seems to come true. Vaccination was supposed to be our reprieve from doing these recurring risk calculations. And to be sure, to a very large extent, that logic, the promise of vaccine, still holds, even against the far more transmissible Delta variant. The vaccines we have right now, including one that was just fully approved, which I'm sure we'll talk about, the vaccines we have are doing a fantastic job at preventing hospitalizations and deaths from COVID. But not everyone can get a vaccine. For example, children under 12. And as cases and hospitalizations have roared back, the concerns about breakthrough cases among the vaccinated, as well as concerns around children, have muddied our ability to gauge our own day-to-day risk. Just as we all were starting to venture back out into the world, to hug, to eat, to laugh, and enjoy the same airspace that many of us have not been able to have. I just want to acknowledge that in some ways, the Delta chapter of the pandemic saga is more confusing than ever. Now, let me be clear. Here is what has not changed. Vaccinated people remain safer than they've been for the past year and a half. And unvaccinated are perhaps at an even higher risk than they were back in March of 2020. But what has changed and what makes things challenging right now is that risk across the population, across the state, is no longer distributed uniformly. What we have now is not a homogeneous risk, but heterogeneous risk. Back in March of 2020 or August of 2020, we were all pretty much at the same level of baseline risk. For those with chronic conditions, their risk was higher, but generally speaking, because we didn't have a vaccine, our risk level was pretty much uniform. But now, in light of that vaccine, we now have pockets of risk and pockets of relative safety. But that question of how to go about your day in a safe manner persists. So I'd like to try to capture the way that at least me and my family think about how we go about those activities. And for us, choosing what activities you participate in and which ones you forego comes down to two questions. What's your risk of being exposed to COVID-19? And then, what's your risk of possibly infecting someone else? If you're fully vaccinated and healthy and are hanging out with other fully vaccinated people, your risk of getting exposed is very low. But perhaps there's someone in your life who you care for, a grandparent who recently had an organ transplant, who's uniquely susceptible. Even though your risk of getting exposed may be very low, your risk of infecting someone may be very high. And that may change the calculus you employ in determining what activities you would want to engage in. Similarly, if your risk of getting exposed and what might happen to you is very high, maybe you yourself recently had an organ transplant. It doesn't really matter at that point who else you might infect because you yourself are at a very high risk. These two questions exist on a sliding scale. And as the risk of one goes up, you may need to index the risk of the other. But thinking about how we go about our lives in terms of the risk of exposure and the risk of infecting someone else that you know who's in your community, a loved one, answering those two questions, frankly and honestly, is the way that we at least are going about thinking about our daily lives. Now, I know that's tough. I know it's confusing, and I know it's not easy. It's not a quantitative point scale that you can assign points to different activities and know whether it's a green light, a yellow light, or a red light. Unfortunately, we're likely to be riding this roller coaster of risk assessment for some time. Periods of confusion are natural. And as the virus evolves, so too does the scientific understanding around that virus, and thus our best advice on how to protect you and your loved ones. But I want to take a minute again to acknowledge that we're all tired of best public health behavior. Thankfully, the key variables have not changed. The best step that almost everyone can take to stay safe is to get vaccinated. And then around that, make smart public health choices. Sit outside where possible. Try to find places where ventilation is high. Wear a mask when you're in an indoor public setting. Avoid visiting an elderly parent or grandparent, or perhaps your cousin's new baby, shortly after going to a crowded indoor event where there wasn't masking and there may not have been a lot of vaccination. The situation that we are all in remains complex, complicated, and there will be twists and turns. But the best ways to keep yourself and others safe remain straightforward. I've done a lot of talking today. There's a lot to catch folks up on, but eager to hear from our colleagues in the media. So let me go to Patrick Whittle first.
Thank you very much. You mentioned earlier that the Delta is not just the predominant variant in Maine, it's the variant. Are there any numbers that speak to just what percentage of the cases in the state are the result of the Delta variant? Are those numbers available?
They are, Patrick. I'll give you the snapshot of them here. In big picture terms, over the last 2 to 3 weeks, 98 to 100% of the new cases in Maine are likely attributed to the Delta variant. Here's what I mean by that. We receive samples from individuals who have tested positive in Maine, a subset of those. And we take those samples and we do the full sequencing. And starting a week ago, 100% of those samples that we were sending for sequencing were coming back as the Delta variant. This week it's 98%, but still essentially all. So that is a reflection of who is getting COVID and the variant that's driving it.
I see. Good to know. In some cities and other locales around the country, we've seen a return of things like indoor mask mandates or other kinds of guidelines that we associate probably more with the early pre-vaccination stages of the pandemic. Is Maine considering doing anything similar to that?
You know, our approach, Patrick, since the end of the expiration of the civil state of emergency, has to shift from mandates to recommendations. That is partly because we now have vaccines on board, which are one of the most effective, most exquisitely effective ways to protect yourself. But also the absence of the state of emergency meant that our ability to enact things like uniform or universal mask mandates or indoor mask mandates goes down commensurately. So our approach has been to make recommendations that we think reflect the best available science that are typically the result of deliberations by the US CDC and federal public health authorities, and make those recommendations. For example, a recommendation that individuals in counties of high or substantial transmission wear a mask in an indoor public setting. That's a recommendation right now. And I think for now, again, given the absence of the state of emergency, that's how we're thinking about those recommendations.
Yeah, one final thing before we move on, actually, about exactly that. The CDC recommendations about high and substantial transmission, those are not especially well publicized, and they change a lot. So what can the state do to make sure people are aware of them, because over the course of the week, your county can sort of bounce in and out of those categories. And I feel like most folks probably don't spend a whole lot of time looking at the CDC transmission map every day.
Yeah, you're right, Patrick. First of all, acknowledge it's frustrating. It's frustrating, if I may be somewhat silver lining-ish. It's frustrating because as compared to other states, which are and have been solidly red, there are some places in Maine with lower risk than others. But that's perhaps a reach too far on the silver lining front. But you're right about the publication. We do have a link to the latest designations from the US CDC on Governor Mills's COVID website. But you're right, we could and need to do more about making those more publicly available and accessible.
Thank you so much.
Yep. Let me go next to Jim at WMTW.
Hello, Dr. Shah. Thanks for taking the time to speak to us today. You had mentioned about the breakdown of the hospitalization. I'm focusing on today, the 70 to 75% of the people in the hospital unvaccinated. So that does leave the 25 to 30%, we assume, to be vaccinated, whether that be partially or fully vaccinated. And I think the public would like to know, I'd like to know a little more about the vaccinated patients. Are they in better shape than the unvaccinated? Are they not in the ICU? Are they not on ventilators? What can you tell us about that? Because people are still saying, well, you see, you got the vaccine, you still ain't in the hospital.
Well, I appreciate that question. I think the place to start that discussion is by recognizing that these individuals who have had breakthrough cases and have resulted in them being in the hospital still represent a rarity. Even though there have been a number of breakthrough cases, only a small fraction of them have resulted in hospitalization. And when you compare that against the new numbers of cases that have been logged since vaccines became available and the number of new hospitalizations that have occurred since that same time back in January, the number of breakthrough cases remain uncommon. That continues to be strong and proof positive that the vaccines are working. The other thing to note, Jim, is that breakthrough cases are fully expected and anticipated, or they were predicted and predictable. No vaccine, no medical intervention is 100% effective. The vaccines that we have register from 75 to 90+% on the vaccine efficacy scale, which is astounding for vaccines, but not 100%. The breakthrough cases, again, are predictable and were predicted. The last thing before I directly answer your question, it's important for context though, is that breakthrough cases are a small fraction of people who are fully vaccinated. And as the number of people who are fully vaccinated goes up, something that occurs at the same rate in a small group of people will result in a small number of cases. But something that occurs at the same rate in a really large group of people, breakthrough cases and vaccinated, will generate more cases. So one reason among many that our numbers of breakthrough cases and breakthrough cases nationwide have gone up is that there are simply more vaccinated people. There are models that run the math that kind of show, even though there are more breakthrough cases, you would still rather live in a community where 90% of the people are vaccinated rather than 30%, even though you're going to have fewer breakthrough cases than the 30%. All of that is a wind up to say, what do we know about the breakthrough cases, particularly those who end up in the hospital who are vaccinated? In general, they tend to have other pre-existing conditions that led them into the hospital. In general, there is no one vaccine that predominated one over the other. Overall, their hospital stays can be longer, but that's again, largely a function of the fact that they usually have a pre-existing or severe medical condition that got them there. Overall, if you're concerned about landing in the hospital with COVID-19, which is a risk, the single best thing you can do today is to go get vaccinated. Breakthrough cases, although they are concerning to many out there, I'll be straight with you, Jim, they're not what's keeping me up at night.
But still, it seems like a high percentage of people that are in the hospital that have been vaccinated. And is it safe to say that had they not been vaccinated, then they'd be dead?
I can't speculate as to how they would fare. I think it's safe to say that had they not been vaccinated, they would have fared worse. Can't say for sure how much worse, but we certainly know that those individuals can assume they would have been exposed anyways. Had they not been vaccinated, there's little doubt that their clinical course would have been much worse, especially given the fact that many of them have pre-existing medical conditions.
Thank you.
Thanks, Jim. Let me go to Patty White next.
Thank you, Dr. Shah. You talked about outbreaks at healthcare facilities. First, can you actually tell us, how many outbreak investigations? You've got 21 now. How does that compare to 2 weeks ago? And then what kind of healthcare facilities are you seeing these outbreaks in?
Sure, Patty. I'll get you the numbers of exactly how many outbreak investigations we had open 2 weeks ago. It was fewer than we had today, but I'll get you the exact numbers. It's also important to note where we've been even just 6 months ago. Back in February, in the midst of a previous surge, there was a point at which we had well over 100 outbreak investigations open. So again, the vaccines are still, they're doing their work, but there are still outbreaks that are happening. In terms of the composition of the healthcare facilities, they run the gamut. We have outbreak investigations in healthcare facilities at a nursing home, at a healthcare facility, at long-term care, at 2 hospitals, and at 1 group home. Just to give you a big picture snapshot. So they do run the gamut of healthcare facilities. Patty, what's important to me is that these are facilities that are within the ambit of the announcement that Governor Mills made last week around healthcare workers becoming vaccinated. The reason I mention this to connect the dot even more completely is, as we've talked about over the last 18 months, many outbreaks, not all, but many outbreaks in healthcare facilities begin with workers. And the more we can keep those staff COVID-free and reduce their likelihood of being sick, first of all, the more we can keep them on the job and not having to be out with quarantine, which means that the facility can continue to provide care. But I also believe that by doing so, we can reduce the number of outbreaks. That remains to be seen, but that's my expectation.
Okay, and then speaking of the vaccination mandate for healthcare workers, I'm sure you're aware there are some groups who have concerns about the mandate, like EMS providers, who some say that the deadline to get vaccinated is too fast. There's not enough time to have conversations to help people feel comfortable. Some people say that there's going to be an unintended consequence where people really will leave their jobs. I mean, I guess, what's your response to those? And is the state considering any sort of changes to the mandate, any added flexibility?
Sure. Thanks, Patty. Bottom line, not at this time. Let me respond to some of the points that have been raised, though, which I understand. Well, let's start with concerns that have been raised by our colleagues in the EMS clinicians in their world. We start by noting that EMS personnel, be they clinicians or others, play a really critical role in protecting the health and welfare of Maine people. I noted this for them when I met with them during the board meeting yesterday. Frankly, I was disappointed that the EMS board chose not to fully align with Maine CDC's vaccination requirement for healthcare professionals. This is a requirement that, as I've noted today and noted yesterday, is intended to really protect their lives, as well as the lives of every single person that they serve, as well as to keep our entire force of EMS clinicians safe, up, ready, and healthy. I was disappointed in that decision. I recognize that there have been those who have expressed concern about the timeline. There too, I think it's really important to note, vaccines in Maine, COVID-19 vaccines in Maine, are free, easy to obtain, and are available today. I'm going to be straight with everyone. There is no reason that anyone in Maine, healthcare provider or not, cannot go out today or tomorrow and get a COVID-19 shot. If they were to do so, they would be able to be in compliance, if they were a healthcare worker, with the healthcare worker vaccination rule. I know that that's tough for a lot of folks, but those are the facts on the ground. There's a lot at stake right now as we think about outbreaks, as we think about more and more healthcare workers becoming infected or exposed. So for those reasons, Patty, while I understand the concerns, for me, the prime directive here is to do what the Hippocratic Oath says, which is to do no harm. And for those reasons, we're not contemplating any changes.
Thank you.
Thanks. Let me turn next to Rosalind Flaherty.
Hi, Dr. Shah. Going off of what Patty just asked, I think there is some confusion. So what the EMS board voted on yesterday does not go into effect, correct? I think there's some confusion that people think, oh, now I have longer to get vaccinated.
I would refer the specific questions there to the EMS or to the Department of Public Safety. The way, Rosalind, that I understood or viewed the board's vote was around enforcement measures. Maine CDC, Maine DHHS's rule, the rule that Governor Mills signed off on and put her stamp of approval on, is in effect. And I view that as the governing rule. I believe the EMS board and their pronouncements were focused on potential enforcement and disciplinary actions that they may elect to take in the event that someone is not compliant. But for the specifics there, I would want to make sure we loop in and consult with the Department of Public Safety.
Okay, and is the state issuing any guidance to childcare facilities about requiring staff or families to be vaccinated for COVID, since kids are too young right now to be vaccinated?
Nothing of that nature at this time. Certainly, again, as I've mentioned, we discuss everything. There have been discussions about that, but no announcements, no final decisions, no pronouncements at this time.
Okay, and one last question. I know you've kind of mentioned this, but how concerned are you about these hospitalizations and that they're going up? I'm
concerned. I don't have a metaphor. I don't have a turn of phrase. I'll be straight with everybody. I'm concerned. The numbers are high and they're going up. They are largely among individuals who are unvaccinated. They are largely among younger individuals, younger Mainers, and they're largely from rural Mainers who are then being transported to secondary and tertiary care hospitals. Not just with COVID cases, but I've been in frequent contact with hospital leadership and clinical leadership across the state of Maine, from north to south to east to west. And what I've heard over the past 2 weeks is that the hospitals are filled, or they're stretched, I should say, and healthcare workers are similarly stressed, stretched, and tired. Not just with COVID, but other things that are happening as well. As we've all gone back out, there are more accidents. There are more people that are catching up on other care, more severe hospitalizations, more major surgeries. So healthcare capacity is something that's a concern, and it's only magnified and amplified by increasing numbers of COVID.
Thank you.
Let me turn to Corey at WAGM next.
Thank you so much, Dr. Shah. Thank you for taking this time. My first question is, with the number of cases, positive cases within schools going up, obviously with schools just opening, is there any type of talk between the CDC and the Department of Education to re-implement some type of mask mandate within schools?
Well, Corey, thank you. And certainly I know that in your neck of the woods, this has been a topic of conversation just in the last 24 hours with at least one school. I think our review there is, and I'll sort of cross-apply what I noted to Patrick, which is that with the expiration of the civil state of emergency, the approach that we have taken has shifted away from mandates and toward recommendations. That is similarly true with respect to masking in schools. The US CDC and the Maine CDC recommend that there be masking in schools regardless of vaccination status. There are many reasons for this. We recommend that, and we similarly recommend that schools, school boards, and school administrative units take that recommendation and implement it such that there should be masking in schools across Maine. But this is part and parcel of the approach that we've taken to move from mandates and more toward recommendations, which then allows for local control of these decisions.
Okay, thank you. And my next question being, you kind of touched on it with the EMS board and with the EMS workers there, but with healthcare workers as a whole, especially across the state, we've seen protests against the vaccine mandate. We've seen a bunch of people, which they're basically claiming, body autonomy and that they should have the choices over their medical choices. I was just wondering if I could get your response to that.
With respect to my colleagues in the healthcare profession, I disagree with them. Let's start with the baseline. Working in a healthcare facility already subjects and obligates you to do certain things to prevent you from getting your patient sick. There are already vaccinations, a requirement that's existed for 20 years to get vaccinated against things like hepatitis. You would not want to go to a hospital where your healthcare worker could accidentally give you something like hepatitis. We also ask healthcare workers to get tested for things like tuberculosis using a deposit, by where we deposit a protein on them to see if their body reacts, because we don't want healthcare workers to accidentally give TB to somebody. COVID and the COVID vaccine, seen in that context, is no different. Now, I recognize that folks frame this as a question of autonomy and choice, and that choice still exists. But it's not a different choice than the choices that we've already asked them to take on with respect to other vaccines and TB testing. Ultimately, the choice is theirs. This is not a mandate. This is a condition of employment. If you choose to work in a healthcare facility, this is one of the conditions that is similar to the other conditions that are already in place for other vaccines and TB. I've said this twice already, but I'll say it again. Almost everyone in healthcare takes some version of the old Hippocratic Oath, which starts with do no harm. That is the guiding principle that underlies why I feel it's important for those in healthcare to be vaccinated, not just against hepatitis, not just against measles and mumps, but now, in light of the current pandemic, also against COVID. I'm going to put one more fine point on this. My mom had to go back to the hospital, and I thought there was a chance that she could get COVID from a healthcare provider. I would want to take every single step I could to reduce that likelihood. And that's one of the things, honestly, that does keep me up at night. The possibility that one of my loved ones could need to go to the hospital because of an emergency, and while they were sick, accidentally get COVID from a healthcare provider. To me, that's one of the things that's keeping me up. My hunch is, based on conversations I've had with other Mainers, it keeps a lot of other people across the state up at night too.
Thank you. And my final question here is: there's a lot of talk going around with the wording of the Pfizer FDA authorization. I guess there's maybe a paragraph in there that mentioned emergency use for the 12 to 15-year-olds, and the fact that they changed their name. Is there anything you can say to speak on that authorization?
Yeah, there's already been some hand waving about this. There's neither much smoke nor heat here. The bottom line is FDA set very strict standards as to when they would fully approve the vaccines based on X number of months of full and complete safety data. They have those data now for the 16 and over, because as you will recall, they were the first group to get the emergency use authorization. So they now have enough data to give the full approval for that 16 and over group. There's now a second tranche of data that will be coming in on a rolling basis for the 12 to 15-year-olds. Once those data are in, and if they support approval, I have no doubt FDA will go in that direction as well. Let me go next to Emily from the Sun Journal.
Hi, good afternoon, Dr. Shah. So really quick, I wanted to go back to those 1,700 cases that are currently waiting confirmation. Are all of those cases, were they all recently tested, or are those kind of a backlog?
No, those were all recently tested and reported to us in the last 24 to 36 hours.
Okay. And then going back to some of the questions Corey asked about healthcare workers, I've been speaking to some healthcare workers and about the mandate and their reasons for not agreeing with it, or I guess I should say the condition of employment. And you kind of answered this already, but I want to hear again, what responsibility do healthcare workers have to their patients or to, I guess, the community in general to follow these certain recommendations? Because, like one of my colleagues, a licensed practical nurse told one of my colleagues, quote, "We were heroes, now we're zeros." So what's the disconnect between someone who thinks that this mandate is somehow, kind of a plague on them versus the responsibility that they have to their patients?
Yeah, I've seen that as well, Emily. And let me start by noting that this is a hypothesis, so I'm veering into dangerous territory. But I think it's always important in these types of questions and discussions to get a sense of whether who we are seeing is the vocal minority versus a very strong and supportive silent majority. Because overwhelmingly, the emails and texts and tweets that I've gotten have been in support of this, even from healthcare providers. So I don't want to, for a second, castigate healthcare providers and suggest that uniformly there is opposition to this. I suspect, or I hypothesize, that what we are seeing is perhaps a vocal minority, but yet there being a strong and silent and supportive majority. Where I think the disconnect is, though, is that it's perceived as something new that's being foisted upon them because the vaccine, until yesterday, was under emergency use authorization. It can't be that they are outright opposed to vaccinations or medical tests, because again, those have existed for healthcare providers in designated healthcare facilities for quite some time in Maine. So it can't be that. I think it's got to be the fact that this is new. And the fact that we now have a vaccine that literally carries the FDA's seal of approval on it, I hope will be an opportunity to have a discussion with healthcare providers around this. I think, Emily, you and others know that my approach here is never to be me versus them, us versus them, antagonistic in any way, shape, or form. If there are healthcare providers who have questions, the best thing to do is to touch base with the leadership of the facility that they work in. It's almost certainly the case that there is an open, earnest, and honest answer to any question that's out there. That, to me, is the way to start this conversation, rather than pitting it as an us versus them. As you say, Emily, there are probably individuals out there who have questions. Our job is to make sure we can answer them.
Okay, thanks. And my last question, can you put this current surge in context? Because, I was thinking about right after the vaccines rolled out universally, cases went way down almost immediately. And now we're kind of seeing daily cases creep up back to a number that feels reminiscent of previous surges. So what's different about this surge and what's the same?
Yeah, let me start, Emily, by correcting something I said a second ago. I told you 24 to 36 hours. That's not correct. It's 36 hours. So I just want to be really clear on the numbers there. In terms of differentiating the surge or comparing it with others, it's remarkably similar in many ways to earlier surges. Just if you were to look at the graphs, the slope of the curves and such things are pretty evocative and are almost, in some respects, a textbook definition of exponential growth. So in that respect, they're similar. What's different about this surge as compared to others are at least two things. Number one, who is being affected? That is to say, vaccinated individuals are still, by and large, extremely well protected. This is to co-opt a phrase from the US CDC director, this is a surge of the unvaccinated, particularly in Maine. The other thing that potentially differentiates it, we don't know the answer yet, it's a potential differentiator, is the impact of the surge on kids. Generally speaking, throughout COVID, one of the blessings has been that children were less affected and less severely so. Our data right now are suggesting that children right now in Maine are getting COVID at approximately the same rate as their unvaccinated adult counterparts. Thankfully, they are not landing in the hospital at higher rates. That continues to be a finding and a good finding, but they are getting COVID at about the same rate as their adult counterparts, whereas in previous surges, adults were getting COVID at a much higher rate than children were.
Thanks, Dr. Shah.
Thanks, Emily. Mal Meyer, over to you next.
Yeah, thank you, Dr. Shah. I want to bring it back to something that you mentioned earlier about not bringing back certain restrictions because the end of the civil state of emergency. But how could the state really not bring back the state of civil emergency if we're nearing previous peaks of people in the hospital or in the ICU?
Yep. Now that's a fair question. It's one that we've been discussing here as well. Part of the calculus or the analysis is what would the reinstitution of the state of emergency enable us or allow us to do that we're not able to do right now. And as we think about surge capacity within hospitals, things of that nature, all of that, as well as getting the support of, say, our colleagues in the National Guard and things of that nature to continue to assist, all of that can be done even absent a state of civil emergency. Now, that's not a hard no. If circumstances warrant it, such that reinvocation of the governor's powers is needed, well, that'll be the question on the table for debate. But right now, the things that we are doing, the things that we need to do, can be done absent that. Let me give you a quick and concrete example. We needed to secure more Johnson & Johnson vaccine in the state because there's a demand for it, and I wanted to make sure we could satisfy that demand without fail. There have been some ongoing challenges, I'll call them, with J&J's facility in Baltimore. So I didn't want to wait. Wasn't interested in waiting for 2 or 3 more weeks to get an ample supply of J&J. Our director of immunizations here at Maine CDC, she worked the phones, she and I both worked the phones to identify pots of J&J vaccine across the country that we could go find, obtain, and bring back to Maine. We immediately touched base with the National Guard to provide logistics support for those missions, and those missions are now going to be underway. A very complicated operation, an emergency operation for sure, but not one that needed executive powers.
And now shifting over to the issue of schools, since many schools are returning next week, most that we've been able to find are not offering a virtual option. Only in certain circumstances in certain districts are they even offering this for students with well-documented medical needs. Should schools be considering offering a virtual option again?
Mel, first of all, I would want to make sure we looped in the Department of Education because I don't want to speak to the virtual option piece. There's probably a series of discussions that have and are ongoing that I may not have been a part of. So I will only give you the public health piece of this, recognizing that I would recommend we touch base or you touch base with the Department of Education on that. The bottom line right now, from a public health perspective in schools, is that we learned a lot about the ways to keep kids safe in schools last year. And indeed, throughout the course of the school year, the rates of COVID in schools are actually lower than the rates of COVID in the general population. We're building upon that knowledge going into the next school year with things like rolling out more pooled testing. So kids are tested on a frequent periodic basis. All of which I think will make schools at least as safe, hopefully even safer than they were last year. Nothing in COVID is set in stone, though. That could change. If it does change, there may be the need to have these flexible options, as we saw already in Van Buren up in Aroostook County. I don't know that schools need to be out there planning for this, but that's not my lane. I would want DOE to weigh in on that. My view is that based on the public health knowledge we've acquired thus far, in-person education can be and should be done and can be done safely, but there could be changes to that based on things like the next variant out there. So we still need to retain our flexibility.
Thank you.
Thanks, Mel. Let me go to Caitlin at the BDN next.
Hey, Dr. Shah, good afternoon.
Yeah, it's good to catch up. It's been a while.
I know. It seemed like we wouldn't be speaking for a while, and now I sense that perhaps our weekly chats may be coming back.
They might be.
So I guess I first wanted to circle back to this question about the testing for the Delta variant. Can you tell me how many of the overall, let me back up. What percent of tests is the Maine CDC testing the Delta variant for? Is that all tests or is it just a subset?
No, it's a sample. So it's not all tests. I had the numbers in my notes yesterday. I'll get them for you, Caitlin. I want to say, let me just see if I can pull them up really quickly. It's the benefit of doing pressers on Zoom. I can check in on notes really quickly. But we are among the top states that in terms of the percentage of samples that are positive that we are sequencing. And we are at 10%. So about 10% of all of the PCR, it only works for PCR, 10% of all of the positive PCR results that are done in the state of Maine are being sequenced. And as of a couple of days ago, that put us in the top 5 of all states in terms of the percentage of positives that we were sequencing.
Okay. My second question was, you were talking about ICU bed stats, and I was really struck by the number of how few there seems to be left. Do you have an idea of like whether like bed capacity overall has changed? Like, do we just have less beds than before? Like, what's going on there?
No, it's a couple of things, Caitlin. It's a bed capacity in terms of the physical number of. So let me back up. When we report out beds, X number of beds are available. 52 ICU beds are available. That is a number that encapsulates not just the physical bed, but what is 10 times more important than the bed, which are the healthcare workers to staff it and provide care for it. So that's really the essential piece. What has changed recently is not the number of beds. It's the number of the overall number of people that are in the hospital for COVID or for non-COVID. In my conversations with chief medical officers across the state, what's been crystal clear over the last 2 weeks is there are just more people in the hospital right now in Maine than there have been. EDs are full, and thus hospitals are full, and thus a subset of those ICU beds are also filling up with COVID and non-COVID alike.
Okay, so it might be more of an issue of like one, staffing, and two, just the fact that there may be more people in the hospital for miscellaneous reasons currently.
I gather, Caitlin, that it's far more the latter, more people in the hospital for various and different reasons, more than staffing, which I don't know has changed appreciably. It's more that there are just more people in the hospital, COVID and non-COVID. Yeah.
Okay. My next question is, there's reports recently that Abbott Labs may have destroyed some of their testing kits, and that may cause challenges for testing in the future. And I'm wondering if you are concerned about that. You know, could that be a problem for Maine?
Yes. Bottom line, yes. I've read those reports. I have not had direct conversations with Abbott myself, although our director of testing operations has been in contact with them to try to learn more. I'm with our national association, of which I'm active. We are determining how to get some better answers from Abbott to help better inform our use of these Binax Now tests, because they have been literally instrumental here in the state of Maine as part of our larger testing architecture. But I've read those reports. I was concerned by them. I was disappointed in them, and I'm eager to hear from Abbott exactly why it was the case that tests needed to be destroyed versus preserved and kept on the shelf for another period of time.
Could you talk a little bit about what, if there is less tests available, what does that mean on like a practical sense when we're trying to keep track of the virus in Maine?
Yeah, I'm happy to, Caitlin. I won't veer into speculation territory, but let me give you an example of something that areas I'm concerned about. We're predominantly or principally referring to the Binax Now test, the little credit card test that gets you a result back in about 10 minutes. There are a number of uses that we have deployed the Binax Now test for across the state. I'll just highlight two. The first is for periodic, frequent testing for individuals who are going into higher risk situations. So, for example, before someone's shift, having them tested so that if they're in close proximity, they're not carrying the virus. The absence of that will make that type of periodic testing a lot more difficult. A second example is around the pooled testing that occurs in schools. An adjunct to pooled testing is, what happens if a pool is positive? What do you do next? And the answer is that you test all of the kids in the pool with Binax Now. Absence of those will be a challenge. And then the third, not the third, is in outbreak settings. We utilize Binax Now for frequent repeat testing so we can get a better sense of how an outbreak is evolving. And our national association is trying to get a better sense and get some answers, but I'm just disappointed in the reports and I'm concerned.
Thank you. And my final question, sorry to be so far ranging, but lots of little concerning figures coming out today. So on the subject of requiring vaccines, the Maine University system has seen only 66% of their students report that they're vaccinated, and it's not clear how quickly healthcare workers are closing the gaps after the requirement was announced. And I'm just wondering how effective are you seeing these requirements at getting people to be vaccinated? Are you concerned that people might not be getting them fast enough? And is there anything the state, are they the way to improve vaccinations at this point?
I think it's too early to tell, Caitlin. I think that's my bottom line. My understanding from epidemiologists and others who study the effect of vaccine mandates has been that after other attempts have been tried, which we've done here in Maine, mandates have shown themselves to be successful. The proof will be in the pudding here in Maine with respect to the groups that you mentioned, though. I am not concerned yet. Again, though, it's too early to tell in terms of how effective the mandates will be. Even in the early days, though, Caitlin, we've seen an increase in vaccination rates in Maine in general over the last 2 weeks, and in particular over the last 9 or 10 days. I can't tell you, nor will I speculate, whether that's driven by healthcare workers. I've heard anecdotally that it is, but that's not data. That's just stories. So I think it's too early to tell. We won't really know until all the data are in.
Thank you.
Thanks. Let me go to Amy Brown next.
Thanks, Dr. Shah. First, I just wanted to follow up on something you said earlier. You're talking about the people who were in the hospital with breakthrough cases, and you said, I don't know if this is an exact quote, but this is what I scribbled down, that in general, they tend to have other pre-existing conditions that led them to the hospital. So are you saying that these are folks who were hospitalized with something else and then found to have COVID as well?
Thanks for clarifying that, Amy. No, I am aware of... No. So in general, what I'm referring to are situations where someone had pre-existing or severe chronic illness, or in some instances that we've seen, individuals who may have been an organ transplant recipient or something of that nature and were immune suppressed. So they already had a baseline level of illness. And then getting COVID was the 1-2 punch that landed them in the hospital. So they were hospitalized because of their COVID.
Okay, thank you for clarifying that. The numbers are going way back down again in Waldo County after a big spike and at least 3 outbreaks. I just wanted to see if there were any updates on outbreaks in Waldo County. Are they all closed now, or?
No, they're not. The outbreak at Waldo County General Hospital remains open with a total of 17 cases, at least associated with that outbreak. There have been, thankfully, not that many new cases on a day-on-day basis, so it's not accelerating. Overall, Amy, what we've seen in Waldo County is very sustained levels of community transmission as compared to outbreaks that were driven by focal outbreaks. In Waldo County, it's much more high levels of community transmission as opposed to outbreak-driven transmission.
And the 17 or so folks with the Waldo County outbreaks, is that still among just healthcare workers?
I'm not sure. There may be some patients in that number, so I don't know the answer, Amy, but we can check with the outbreak investigator and get a breakdown of that.
Okay, thank you. And just 2 other quick ones, I think. How many people are currently hospitalized due to any kind of reaction from vaccines? Because people are very concerned that the vaccines are dangerous. So I thought it might be good to get an update on vaccine reactions.
The answer is 0. So if you are 100% more likely to be hospitalized because of COVID than you are because of the vaccine.
Okay, great. I thought that would be a quick one. And then just finally, can you say anything about what's being done to ramp up for boosters? Will those be offered in a clinic kind of program like the original vaccines were to start?
Yeah. I'm glad you raised that, Amy. I wasn't sure what I wanted to talk about boosters, but as you heard, I had a pretty long monologue, as Patrick likes to call them. So boosters got put on the cutting room floor today. We'll have time to talk about boosters sometime soon. Let me just start by noting that individuals who are immune compromised, severely or moderately so, are already receiving their additional doses. For the rest of the population, boosters are projected to start the week of September 20th. and they will likely follow the same pattern as individuals were initially vaccinated. So there's some path dependence built in to how boosters will roll out because of the recommendation to get your booster 8 months after you got your second shot. There are still open questions about how we will accommodate the need for everyone to get their boosters, particularly in the peak months, which I project to be December and early January. Whether or how we will need to, for example, stand up large sites again for that concerted period of time, still deciding that. It's a function of whether we have enough existing capacity in doctors' offices and pharmacies. It's important to note that we still have 2 large-scale sites that are still open, the Auburn Mall and the Sanford Clinic run by York County EMA. So the question is whether additional ones are needed. We're working that through right now, doing some models and predictions. So much more to come on boosters, Amy.
Great. Thank you.
Yep. Over to Kevin Miller next.
Great. Thanks, Dr. Shah. Going back to the 1,700 positive test results you got that your team is reviewing, can you just put that in a little bit more context? So that's 1,700 over 36 hours. How does that compare to, in the past? I mean, is that a large number of test results you guys are having to go through? So should we expect to see a really large number of potential positive tests in the next couple of days?
Let's see. Okay, first for context, Kevin, 1,700 is not what we saw back in, say, December when we had several thousand. But, I wanted to note it because I want to be straight with people about where we are. It's something that we're intending to plow through over the next couple days. And as a result of that, there will definitely be an increase in the number of cases that we report, say for tomorrow. Generally speaking, the cases that we report out, a new case number is the number of new cases that were reported to us the day before. And right now, over the next couple of days, what's reported out may not necessarily be from the 24-hour period before, but maybe 26, 27, 28 hours. Does it make a huge difference in policy terms? Perhaps not, but I want to be straight with people about where we are. There will be an increase, and some fraction of the cases that you see over the next 2, 3, 4 days will not be from the immediate preceding 24 hours, but rather from 24 to 36 hours.
Okay. And then looking at the outbreaks you talked about, especially the healthcare facilities, do you know off the top of your head what the breakdown is for vaccinated versus unvaccinated people who are involved in those outbreaks at healthcare facilities?
So a little bit, Kevin. So in general, and I won't go facility by facility, but one outbreak that we're investigating right now, almost all of the residents in this particular facility were vaccinated, but only about 50% of the staff. In other situations, what we've seen is higher staff vaccination rates in the 70% range. But the thing there, Kevin, is that with the Delta variant, the rate that you need to be at to really start developing that shell of protection is now thought to be in the 90+% range. Yet another reason why healthcare worker vaccinations are so critical.
Okay, great. And lastly, on the vaccination. So it sounds like the number of people who are getting vaccinated is going up, probably as a result, I would assume, because of the Delta variant and the rising case numbers, but also potentially the healthcare workers. Can you talk just briefly about, whether Maine CDC, whether you've kind of adopted any new strategies to target pockets that are still unvaccinated, or how you're trying to reach out to those folks who are outside of healthcare settings to try to get them vaccinated?
Yeah, you're absolutely right, Kevin. I think your hypotheses about why rates have gone up, they mirror what we've heard and seen and talked about with folks. Concern over Delta, more now relative safety, or more sense that the vaccines are indeed safe. I've had a bunch of people email me or tweet at me saying, hey, I wasn't sure, but then all my neighbors got it and they seem to be intact, so I'm going to go ahead and do it, and I was fine. And then third, of course, with the requirement for healthcare workers. But we still see pockets of unvaccinated. You can check our zip code map and you'll still see there are parts of the state where there are high numbers of people that remain unvaccinated. We're shifting now toward a really extreme ground game. So we're now at the phase where, for example, 3 weeks ago, I think it was, I spent a Sunday in Lewiston visiting with churches across the cities, going church to church to talk with them one-on-one, or me to church, to congregation, about vaccines and why it was important and the fact that they were safe. And we paired that with a vaccination event right in downtown Lewiston. So it was more than just chit chat. It was, hey, right after the service is done, Pastor, will you bring your congregation to the park and get vaccinated? And we saw a lot of folks come out. That's the sort of direct engagement that we're focused on right now. It's going to be going group to group, asking what their concerns are, and then coupling it, quite importantly, with an immediate availability to get vaccinated. That's going to be a key strategy for us as we go into September.
Great, thank you.
Thanks, Kevin. And the final question for the afternoon goes to Allegra from WABI.
Hi, Dr. Shah. You touched on this a little bit, but I was wondering if you could offer just a little bit more perspective on where we were at this point last year, sort of heading into the school year, and why this year we might not be seeing those same recommendations about contact sports, large gatherings at said sports, and all that comes with that.
Yep. Allegra, so one note there, when it comes to sports and the various recommendations around them, really more the purview of the Maine Principals Association. They really work with schools to figure out what the best approaches are. But as compared to last year, I think it's a bit of both. A year ago, case numbers were quite low, and we had not yet started moving up the curve, seeing more cases. Of course, we go into this school year already being on that curve, and who knows how much higher it will get. But at the same time, Allegra, we know a lot more about ways to keep kids, teachers, and staff safe in schools than we did a year ago. That, to me, is the principal difference. Even though case rates are higher, our wherewithal and ability to keep kids safe is so much greater than it was, both in terms of our understanding and strategic knowledge, but also in terms of our ground game. Rolling out pooled testing to districts to provide that periodic, frequent basis for testing, something that Maine CDC endorses 100%. Those are some of the differences that we've got that I think will keep kids in the classroom. Now, as I talked about with Mal, unclear where the Delta variant will go, to say nothing of Lambda and every other Greek letter that might be out there. So we're keeping our eyes open because we still need to be nimble. But keeping kids in the classroom remains a priority for Governor Mills and everyone else who's working on the pandemic. So that's going to be our goal, to keep kids in the classroom. And based on what we know from the education we've gotten last year, we're well equipped to do so. We just have to keep being nimble.
Great, thank you.
Thanks, Allegra. And thanks all to everyone who's taken some time out of our afternoon to tune in. Thanks, as always, to my colleagues in the media. Good to catch up with everybody again. Just to wrap up with where we were, again, I recognize that we're in a position where things seem to be more confusing than they were a year ago. That's partly because there are now differential rules that apply, or recommendations that apply to vaccinated folks versus unvaccinated folks. And that's an essential part of the risk calculus. But it's also because we're contending with a variant that's more wily and ferocious than anything we've seen before. We're going to do our best to keep folks updated with the latest scientific evidence. But wouldn't be a Maine CDC briefing if I didn't at least once ask everyone who hasn't been vaccinated to go out there and get vaccinated. There are opportunities to get vaccinated with any of the 3 vaccines across the state of Maine today or tomorrow, as you so choose. That is the single best way to keep yourself and your family safe, healthy, and particularly right now out of the hospital. So with that, thank you all for your time this afternoon. As always, please be kind and take care of one another. We will talk again soon.